Professor Yılmazlar will talk to us about using the Six Sigma for the implementation of enhanced recovery in the arthroplasty pathways. And this is really great because Henry Khalid, who introduced the ERAS in colorectal surgery, now what he's doing, they give him millions and millions of money in Denmark to start ERAS programs in arthroplasty, in hip and knee surgery. And I'm in contact with him, as you know, and I'm eager to listen to Professor Aysun Yılmazlar.
Okay. Thank you very much, Professor Medat. Thank you very much for inviting for Dr. Yasser Zoglu. And it's an honor to speak in this platform. And I like to present my speak about using Lean Six Sigma for the implementation of enhanced recovery in the arthroplasty pathway. I will talk about, first of all, introduce myself and my hospital, and then present my hospital's lean journey and today's healthcare transformation and what is ERAS and Lean Six Sigma. And I will present my Lean Six Sigma ERAS project and then concluded about new hospital business model with lean tools. My current position is quality and lean consultant since 2011 in Medicabil Hospital, and I'm also director of anesthesiology and intensive care in my hospital, and I'm also operating theater management and project leader, especially lean and quality projects, and also I'm responsible with medical tourism also. And I want to show where are we. Bursa is in the northwest of Turkey and 1.5 hours far from Istanbul. And our hospital was built in 2011. So we are a very new hospital. And we care over 200,000 outpatients in a year and 11,000 operations in a year and almost 66,000 radiologic analyses and almost 400,000 laboratory analyses a year. And our hospital has 133 beds and almost 500 employees. Our hospital is accredited by Joint Commission International twice in 2013 and 2016, and we collaborated with Kaiser Institute since 2016. And this is my hospital.
The renovated Medicabil Nilüfer is at your service. Medicabil Nilüfer is at your service with its expanded 20,000 square meter area, renovated services, increased capacity, and cutting-edge applications. Medicabil Nilüfer.
And this is our traditional activity. All of us, when we talk in Congress or other activities, we have to read our lean oath. Medicabil's lean oath approach that does not neglect patient and employee safety, keeps facilities safe, prevents waste,
ايوه حبيبي.
شوف الواتساب بتاعك، شوف الواتساب.
Based upon scientific evidence, uses time well, and produces high quality work. We take care to develop and maintain all kinds of behavioral models aiming at continuous improvement and development. Now, I'd like to take you through the Medicabil Hospital lean management journey. Before the hospital opened 2011, the key staff began to study the principles of lean management. After we opened, we started training programs for all the staff and projects. The hospital received JCI accreditation in 2013. And then every year we held some lean activities, and we attending the International Lean Symposium. And this is the Anesthesia book that I written 4 years before. It contains lean activity, lean thinking in the anesthesia. And we continue our lean activity every year. And then in 2016, we collaborated with Kaizen activity. And Beyond Heroes is a very famous book written by Tim Berners in United States. It is about lean healthcare. And we translated this book to Turkish. And after Kaizen collaboration with Kaizen activity, we continue our lean projects in our hospital and the other hospital also. And we also attending as a panelist in the lean symposium also in international. And we continue to our Kaizen activity in our hospital. And we also talk about the television program and some journals to do educated and inform about lean healthcare to our Turkish public and also. So now I'm here. Let's look to review article. In this article, the conclusion said that the healthcare system is moving from pay for volume to pay for value. When we look at the cost of arthroplasty in the United States, in 1970, the arthroplasty cost was $75 billion. In 2010, $2.6 trillion, and last year it was $4.8 trillion. So we have to use enhanced recovery after surgery protocols in our surgery, in our anesthesia practice, because the areas increases patient satisfaction. And very important, ERAS protocol reduces costs. And also, ERAS reduces complications, reduces recovery times, and very important, the ERAS reduces length of stay in the hospital. On the other hand, what is Lean Six Sigma? It is a management method aimed at improving performance based on the synergy of two tools, lean thinking and Six Sigma. The key principle of the lean thinking is to eliminate all types of wastes, like overproduction, inventory, over-processing, unnecessary motion, defects in our healthcare, unnecessary waiting for employee unnecessary waiting, unnecessary transportation, communication defects, and waste of talent. Lean thinking and Six Sigma are two methodologies that complement each other. Lean Six Sigma was used in hip and rear hip replacement prosthetic surgery process, adopting pre-hospitalization as a corrective action to improve the quality of services provided to patients, clinical outcomes, and reduce costs by reducing length of stay in hospital. In Six Sigma projects, we have two phases. In the first phase, we have to mention our project name, beginning and ending dates, and team leader, project team leader, and team members of the projects with their names and duties. And what is the problem? We have to mention that the problem must be a clear, focused, standalone statement that defines the problem. And we have to mention background also, details that cannot be described in the current condition, drawing and useful baseline metrics may be included in this section. And we have to plan of current condition, a drawing that conveys a complete understanding of the current situation is essential in order to realize what improvements may be necessary. Target is very important. A quantitative statement that will form the basis for how improvement will be measured is provided in this section. In many ways, this statement is the hypothesis for the experiment. Goals in this context are equivalent to target, which need to be SMART. It means target must be specific, measurable, attainable, relevant, and timely. And the first phase of project must be constant by manager also. And the second phase, a drawing that conveys a complete understanding of the current situation is essential in order to realize what improvements may be necessary. And we have to do root cause analysis. The root cause analysis section can accommodate either a 5-why analysis or a Ishikawa or fishbone diagram. These two options give the author flexibility depending on the complexity of the problem. And then we have to take countermeasures in the second phase, a listing of the improvements needed to attain the target condition. A listing of specific tasks that will lead to improvements along with timelines, ownership, and the expected outcomes is described in this step. The expected outcomes are an essential component of the scientific process because they provide the basis for evaluating whether or not the improvements are successful. This section also contains how much money will be saved after implementation of the countermeasures and what types of waste have been removed from the process. And a small pilot conducted over 1 or 2 weeks is recommended. And the second phase, end of the second phase is the follow-up. This section contains a description of an audit plan, the results of the audit plan, and if needed, recommendations for how the next Six Sigma will become standard work. So let's look to what happened if the body get a surgery in the OR. So many neurotransmitter or hormonal substance releasing from the so many organs and so many harmful effects can be seen with this neurotransmitter. So this is the result of operation trauma in the body. Enhanced recovery after surgery is a clinical pathways for perioperative quality improvements have been shown to reduce and hospital expenses. Complex as they cross multiple disciplines and span multiple patient care areas. Successful implementation involves creation of a multidisciplinary team of physicians and nurses, ongoing assessment and improvement of the perioperative process, and creation of sustainable measures to ensure long-lasting results. So this is from Gillis published in 2015. In ERAS protocol have 3 periods: preoperative period, intraoperative period, and postoperative period. So you can see here, Gilles mentioned that so many things to do have to be done by team in all this ERAS period. Given the complexity of implementing a large perioperative quality improvement pathways such as ERAS, our team chose to employ the Six Sigma. The Six Sigma provided a framework for success as it included a multidisciplinary team approach to implementation and process to ensure continuous improvement and sustainability. This is very important review, application of lean healthcare in hospital services. This review contains between 2007 and 2017, almost 10 years lean healthcare methodology. As you see here, so many lean healthcare methodology became. This is very complex. You can see the complex graph, but this analysis of the networks deals with the occurrence of keywords shown in this figure, where stand out 5 clusters: lean, Six Sigma, operations, quality, and institution. As you see here, implantation is very important to do new and improve our practical. Now I like to show my project using Six Sigma for the ERAS protocol with the arthroplasty pathway. This is our lean form to use with project. Our project name is Implementation of the Enhanced Recovery in the Arthroplasty Pathway. We start this project 2018, September, finished July 2010, and team leader by myself and the team orthopedic surgeon, anesthesiologist, nurse, physical therapist, and the other perioperative team members. And what is the problem? The problem is long length of hospital stay, late discharge of the patients, and increased cost. And background was long length of hospital stay, increased cost, patient unsatisfaction, and overload of healthcare provider, and also infection with long length of hospital stay. And we plan to check out our current condition to look length of hospital stay records from hospital informatic technology department monthly and yearly. And target is discharge the patient on the same day surgery. And the project was done in orthopedy and anesthesiology department, and the project constant by the manager. And current condition was like that. Between 2011 and 2018, the average hospital patient, arthroplasty patients cases, length of stay in the hospital was average 2.1 days. And we had root cause analysis and put the problem head of fish. And then in the fish bone, we discussed the causes under the title like man, material, management, method, and environment. Our problem was long stay in hospital. What is the cause of man? We do not need no leader and no training about the long stay in hospital. And we didn't have pathway and protocol and no decision, and we didn't have any ERAS protocol, and we didn't have early mobilization field. And we will do 5 why analysis, and we say we ask the 5 times whys on the question. Why the patients stay long in hospital? Because the physician decision. Why physician decision like that, long stay in the hospital? Because there is no ERAS. Why there is no ERAS? Because nobody have knowledge about the ERAS. Why lack of knowledge? Because there's no pathway about ERAS protocol. Why no pathway? Because there's no team and no leader. So the team is take countermeasures. Management built perioperative team in 3 days, and in 1 week, perioperative team designed ERAS protocol and also Arthroplasty School. And 15 days, orthopedic surgeons and nurse and the other team member revised the clinical guideline for arthroplasty cases, and Lean Institute coordinator analyzes the current condition, and perioperative team used ERAS protocols during the 6 months. And after 8 months, Lean Institute coordinator analyzes the records. And also after the ERAS protocol, when the patient discharged at home, home care center team care the patients at home. And we also, after ERAS protocol, we follow the projects with length of hospital stay. And as you see here, our member team, perioperative member team, this is core team, a very important team. There is anesthesiologist, orthopedist, dietitian, physiotherapist, and OR nurse and clinical nurse. So, individually, everybody has their own disciplines. The core group of perioperative medicine team serve as an intraoperative champion after the implementation process to teach other members, care providers, about the ERAS clinical pathways. And the center is patient. Everybody focus to patient. And we also designed the organized Arthroplasty School. As you see here, our orthopedic surgeons informed the patients and relatives about arthroplasty, knee and hip arthroplasty surgery. And also nurse, dietitian, physiotherapist, anesthetist present about this survey, arthroplasty survey, to the patients and relatives by this slide, education slides. And we have arthroplasty clinical guidelines like that. Each disciplines and preoperative or after operation and discharge day, every individually who needs to do here, everybody knows what they do. And this is our guidelines about the arthroplasty care. Before ERAS, we discharged the patients about approximately in postoperative 2 or 3 days. But after ERAS protocol, we sent the patient home in the same day surgery. As you see here, before ERAS and after ERAS, our clinical guidelines differentiate. And this guideline for early mobilization is very important, especially for physiotherapists and nursing. So we educated, informed all healthcare how the patients mobilize earlier, what should be care, what is the important point we have to care in the bed, sitting position, standing, walking, and back to bed is important for the patient. For you see here, have 3 periods. Preoperatively, we have to do preoperative assessment and inform the patient about this survey, hydration and nutrition, short fasting duration, antibiotic and thromboembolic prophylaxis, and no premedication. And intraoperatively, we use short duration analgesic and anesthetic drugs. We can use spinal anesthesia, epidural anesthesia, or general anesthesia also. The anesthesia technique is not different for the ERAS. Peripheral analgesia And periarticular injection we use for the postoperative analgesia, because periarticular injection is very useful for early, especially postoperative, for 24 hours period for analgesia. No overload fluid and stable body temperature. In the postoperatively, we noticed very, very careful care about emesis prophylaxis, no overload fluid, early removing of the catheter, early oral intake, non-opioid analgesia, early ambulation, and normothermia. Intraoperatively, the arthroplasty cases position, monitorization, normothermy, cement reaction, hemorrhage, and thromboemboli is very important. We are very carefully care about that. And on the other hand, orthopedics should be very careful about skin, muscle, fascia, tendon, and minimal invasive approach, mini incision, and minimal tissue trauma, no tourniquet, and no drain. Periarticular injection is very simple and effective method, no effect on incision and no infection risk, and it is local infiltration. Many years ago, Ranavat from New York, Ranavat Orthopedic Center, he uses this periarticular injection. It contains local anesthetic, morphine, antibiotic, corticosteroid, and it helps early 24 hours, postoperative 24 hours, postoperative analgesia. And periarticular injection also decrease the opioid consumption also. And fluid blood requirement is very important for ERAS. We have to use 10 milliliters per kilogram per hour saline, and we use hypotensive anesthesia by pharmacological technique or regional technique, and also tranexamic acid is plasmination activator to prevent bleeding. Hypotensive anesthesia is a technique of lowering the blood pressure of a patient during surgery to decrease the amount of blood loss. As you see here, the surgical area bloodless, because it can help good surgical exposure, short surgery time, minimal tissue trauma, and less blood loss, and less blood transfusion, and also less blood transfusion reaction. So you can see here our knee arthroplasty, after the knee arthroplasty patient. She's postoperative third hour.
Tamam, yürüteç. Pasta hocam. Sonra sağlam hocam. Yürüteç. Pasta. Sağlam. Var mı herhangi başka bir şey uygulanması? Yok. Tamam, yürüteç.
She is my colleague's mother, so she allowed me to show this video to you. In this patient, we had preoperative evaluation and also information to her and her relatives, and we use low-dose spinal anesthesia and also periarticular injection. And after the surgery, we can help her to ambulate postoperative third hour and discharge in same-day surgery. So it means outpatient arthroplasty. When we look at each year, our discharge days average arthroplasty cases in our hospital, we have target to discharge surgery. And this is the short-term outcomes of outpatient surgery for total knee arthroplasty, and we discharge the patients at least 23 hours. And this is our first 11 outpatient arthroplasty cases. As you see here, blue color is preoperative, orange intraoperative period, and gray color is postoperative period. As you see here, average of length of stay is 649 minutes. Average between discharge and the end of surgery duration is 470 minutes. And so we, before the ERAS protocol, the length of stay in hospital, 2.1 days. And after ERAS protocol, after we using ERAS protocol, our length of stay averagely decreased 10 hours, 49 minutes. And when we look at the average hospital cost comparison, surgery time cost, PACU time cost, and clinical time cost, it almost cost decrease 50% approximately after ERAS protocol. As a summary, our ERAS quality improvement project has now become the model for multidisciplinary quality improvement at our hospital for arthroplasty case care. Six Sigma is a vehicle for anesthesiologists and other members to create cultural change within their hospitals and become leaders in perioperative care. At Medicabil, we have implemented this model successfully for the past 2 years. After providing a proof of concept with the arthroplasty ERAS, we are now implementing this model throughout the arthroplasty pathway as well as the other pathways. We strongly believe this model represents as a huge opportunity for the specialties of anesthesiology and surgery. Thank you for your attention.